Cardiovascular health for bodybuilding. I figure with the recent passing of Shawn Rhoden, George Peterson, just saw where Cali Muscle had a 100% coronary artery blockage. It's probably important to talk about cardiovascular health in relation to bodybuilding and PED use. Um, it's one of the big risks when you're a bodybuilder. I'm going to dig into it a little bit. We'll talk about ways that you can mitigate these risks. Before I get into it, if you like my videos, please take the time to like, comment, and subscribe. Share it with anybody you think they could use it. Use this information. If you want to stay up to date with what's going on with me personally, and get updates on videos that are coming out, you can follow me at Paul K. Barnett on Instagram. Anyway, let's dig into cardiovascular health for bodybuilding. There are two things that really primarily, I'm not saying this is the only things that kill bodybuilders, but the two things that seem to take bodybuilders early to chronic things are health, kidney disease, and cardiovascular health. Heart attacks, strokes, aneurysms, blood clots, things like that kill people. The acute stuff that you see is usually just people overdoing diuretics for contest prep. That's stuff that'll kill you like that. These are things that kill you long term. You're not going to notice the. That's the thing. That's why the cardiovascular health. That's why they call it the silent killer. You don't know that you have cardiovascular issues until it's too late. You just don't. There are some warning signs, but people just don't pay attention to them, and they just assume that they're part of it. We'll dig into it a little bit more. Risk factors for bodybuilders. Androgen abuse and overuse. I think people go crazy with the androgens. I'm not saying if you go, that anabolics are 100% safe, but anabolic steroids that anabolic androgenic steroids that tend to be more anabolic and less androgenic cause less heart issues from what I've seen. Um, not always true, but just is something to be aware of. I would my advice on that is use as little as possible to get the job done. Don't blast year round, and stay away from fucking orals and crazy things like Tren and mint and stuff like that. I don't know why guys get this fascination with this shit and want to run it year round. Um, you know, you can't stay ripped. I think it's the desire to stay ripped year round. You cannot stay ripped year round if your genes don't dictate that you're built that way. And it's unhealthy. I think that's a lot of times, it's the guys that look ripped year round, a lot of times are the ones that end up having heart attack and cardiovascular issues. Not always, but that's typically where you see it. So with the anabolic androgenic steroid use, stay with the milder stuff. Stick with test. Use things like primobolan. Only use the dosages you need to get the job done. Don't blast year round. You take some phases and let your health recover. High calorie diets. That's another issue. When you're eating a shit ton of food, it can take its toll on you. Sometimes you need breaks. I see these guys that are perma bulkers that are just bulking year round all year, every year. You're rolling the dice. You're rolling the dice. When you get to be my age, that shit's going to catch up with you. So I think a planned diet, probably once a year to lean out, even if you're not trying to get in contest shape, is good for you. We all know that getting into contest shape is extreme and comes with risk and dangers as well. Um, High fat diets. I see a lot of people get obsessed with keto diets and things like that. I'm telling you, I just don't buy into it. I think if study after study after study shows that high consumption of saturated fats will fucking block your arteries eventually. You may be a genetic freak and it doesn't happen to you, but I do think these keto and carnivore diets are risky. I've seen it in blood work. I've seen people who do them, and me personally, and their lipids just get blown out of the water. That can't be good for your long-term cardiovascular health. It just can't be. Um, Anti-estrogen abuse. Guys are just have this obsession with blowing away their estrogen, and it does make you look lean and hard. But estrogen is protective. It is also neuroprotective. Um, I get it going into a show. You want to crush your estrogen and get that hard look. A few weeks is not going to kill you, but blasting 1 milligram of Arimidex every day, year round, is going to cause cardiovascular issues. Your body, you're gonna destroy your HDL, and you're going to risk plaque accumulation. You just are. I would limit if you can get away with it. I would not use anti-estrogens unless it's for contest prep only. I run my estrogens tend to run really, really high, and I have to use a moderate dose of anti-estrogens year round just to keep mine in check. I mean, mine get insanely high, but most people aren't even getting blood work done to find out if their estrogens are even high. They're just crushing the anti-estrogens because they heard some bro at the gym say that that's what they should do. Only use them if you need them. Stimulant abuse and over abuse. I see guys that do stupid shit like taking fat burners year round, even when they're not dieting, and you're running clenbuterol all the fucking time and T3 and drinking a shit ton of pre-workout drinks that have nasty amounts of caffeine. I say this as I'm drinking my coffee. Uh, but moderate the stimulant use. It will elevate your blood pressure. Which leads to cardiovascular problems long term. Um, Mitigating risk factors. Mixing of alcohol and recreational drugs in with heavy anabolic androgenic steroid use. Just a bad, bad, bad idea. The more risk factors you throw into the pot, the higher your odds are. This is a game of odds. We're rolling the dice when we take AASs. We know this. We're taking a chance. But if you mix alcohol and cigarettes and pot and whatever, cocaine, whatever in with it, you're asking to to die. You just are. Limit the risk factors. Keep the risk factors as low as possible. Excessive body mass. Letting your body fat get too high, even just being big, is rough on your cardiovascular system. If you're you're big Rami size. Guys that are big Rami size don't make it to 70 or 80 years old. They just don't. Um, it doesn't happen. You don't see any guys that size that are 70 or 80 years old. They don't exist. Guys have to downsize as they get older. That's something to keep in mind. I'm concerned about it myself. I mean, I'm 265, 270 pounds right now, and I'm pushing 50 years old. I don't know how healthy it is to be that big at my age, and I have given some consideration to downsizing, and I probably will when I hit 50. I want to do a couple more bodybuilding shows. I am rolling the dice. I know that, but at some point I will probably downsize. What this all results in, you combine all these risk factors together, high fat diets, androgen abuse, too many anti-estrogens, stimulant abuse, mixing of alcohol and recreational drugs, and excessive body mass, and eventually you get into a state where you're hypertensive, your blood pressure's high all the time, your blood sugars are probably elevated all the time. From carrying, you end up in erythrocytosis, where you get your red blood cells are your hematocrit gets too high and your blood basically turns into sludge. Um, you get plaque buildup, and and all this leads to left ventricular hypertrophy, where your left ventricle uh, grows to keep up, and this is all just a recipe to have a heart attack, have a stroke, have an aneurysm, and die. Um, so as we mentioned, health events: heart attack, clots, stroke, aneurysm. Um, so how do we prevent all this? Um, you know, I think one, like I mentioned, mitigating risk. Bodybuilding is a risky sport. All sports are risky. Football is risky. Driving a race car is risky. Climbing Mount Everest is risky. And all of these activities, they take precautionary steps to um, minimize the risk. In football, they wear helmets. They get regular physicals done. Um, they they're working with athletic trainers to keep an eye on their health. And driving a race car, when you're driving a race car 200 miles around the racetrack, you put on a seatbelt, you wear a fireproof suit, you put on a helmet, you have a roll cage in the car. Um, you have people on standby waiting to help if there is an accident. Uh, you know, Bodybuilding, our equivalent of it is reducing risk factors. Okay. Um, Staying away from rec drugs, getting tests done regularly. I'm going to talk about the testing here in a second, how important that is. You don't know with cardiovascular stuff, you don't know until it's too late. You just don't. Sometimes there's warning signs, but most people ignore them. Um, you just don't know until it's too late. So mitigating risk, staying away from alcohol, drugs, eating a clean diet, keeping your body fat relatively low year round, not using bulking as an excuse to eat like an asshole. I do it. I like food, but at the same time, you got to try to eat healthy. Keep the saturated fats low. Just basics like that. So some diagnostic testing that I think every bodybuilder should be doing. I don't care how old you are. Dallas McCarver, what was he, 25, 24 when he died? He had a coronary artery blockage that killed him. That is 100% preventable. If he had just gone and gotten a cardiac CT scan done, they would have noticed the blockage, had a stent put in, he'd still be alive. So the diagnostic testing that people should have done, um, you know, basic stuff. CMP, comprehensive metabolic panel, blood work. You can go get these done on your own, even if you don't want to go to the fucking doctor. I get it. I hate doctors. Most of them are assholes. They frown upon what we do. They don't want to help. Um, there are some good ones out there, but take take this into your own hands. Talk to your doctor about it. Get your blood work done. Take it to your doctor. Tell them what you need. Um, Comprehensive metabolic panel, things you're going to look for. I would get this done once a quarter. Guys wait until it cracks me up. Guys will wait until they were on a cruise for 6 weeks and they're eating really clean, and then they'll go get their blood work done. Of course, it's going to look decent then. When you should be getting your blood done is when you're in the middle of a blast, and you're at the highest risk. Know where you're at. Know where your baseline is, and know where you're at when you're redlining the engine. Because that's the stuff that's going to accumulate. If you do a 4 week blast once a year and you get your blood work done at the end of that blast, that's not indicative of where you're at year round. So you need to know where you're at when you're at your worst and take steps to improve that stuff. So primarily you want to be, for heart health, you want to be paying attention to your lipids, your cholesterol, triglycerides. Um, you want to be looking at your A1C, making sure that your glucose is under control. C-reactive protein, which is an indicator of inflammation. When there's coronary artery disease, there's inflammation in the arteries, and C-reactive protein will be elevated. That is an indicator. An ECG, electrocardiogram. Hell, the fucking Apple Watch will do an ECG. I don't know how accurate it is, but you can, if you want, you can run it with your Apple Watch. You really should go to the doctor and have a professional one done, but get that done once a year. A cardiac CT scan, you can go do this without the doctor if you don't want to go to the doctor. It's $100. Same thing with the blood work. I can get a full metabolic panel done for like 90 bucks. Um, pressure monitoring. Buy a $20, $30 blood pressure cuff off of Amazon and check your blood pressure daily. Checking it once a week is, I personally do not think it's enough because I know with mine's all over the place. Sometimes it's fine. I'll check in the middle of the day, it's fine, and then the next day it'll be up. So you need to look at the averages and look at trends. You'll see that when you take certain compounds, it goes up, and that is an indicator that you either need to lower the doses of that compound, get off that compound, or take some sort of corrective action with blood pressure meds or some sort of lifestyle change. Um, Fasting glucose, you guys do not pay attention to their glucose levels. Look, being diabetic vastly increases your chances of cardiovascular risk. I struggle with my blood glucose control. I always have diabetes runs in my family, so I have to pay close attention to it. A lot of people are that way. They probably just don't even know. Even young, looking back now that I know what the symptoms of high blood sugar are, I definitely had them when I was in my 20s, and I was lean then. I just wasn't paying attention to it. Um, Resting pulse, keeping an eye on your resting pulse. If it dramatically increases, something's wrong. Certain compounds will raise your pulse, that's for sure. Stimulants will raise your pulse. But if you're redlining your heart all the time, that's not good for your your long-term cardiovascular health. Um, RX meds and supplements, some things that you can do to help mitigate the stuff. This is the equivalent of putting the seat belt on and the helmet and the fireproof suit in the race car. This is kind of the stack that I use to help with my cardiovascular health. For prescription meds, I take a low dose statin. I use Prevastatin that my doctor gives me. It is basically, very minimal side effects, if any at all. Um, I am on X-Force for blood pressure medicine. Um, you got to find one that works for you. There are several different types, ARBs, etc. And metformin for glucose sensitivity or for insulin sensitivity. Sorry, to help with glucose metabolism. Those are the prescription meds that I take that help keep my lipids in check. My lipids tend to get elevated. Um, my blood sugar gets high if I don't pay attention to that. So the metformin helps with that. Um, uh, in the blood pressure medicine, it blows my mind that I hear it from bodybuilders all the time and from guys, oh, I don't want to take that stuff because I don't like taking medicine, and or they're worried about impacting their gains. And I'm like, okay, so you'll fucking take Tren and a bunch of fucking crazy fat burners and run a gram of test and blah 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 blah, but you don't want to take a statin? That makes no fucking sense to me. Zero. Uh, Over the counter supplements, my take on over the counter supplements, there are some that work that help, but the way the pharmaceutical companies work, if it was something that was highly effective, they would be manufacturing it and putting a patent on it and making it a prescription drug. Probably the most effective over the counter supplement I have found for cardiovascular health is fish oil. It does raise your HDL. Um, I have seen that, and the main thing that it does is um, helps with clotting. Crazy story. I actually had surgery done a couple of years ago, and I forgot to stop taking fish oil for for the surgery, and I had a major bleed because that's how how much the fish oil impacts clotting. Um, so, that will help prevent heart attacks and strokes. Um, and one fish oil pill a day is not going to do it. I take somewhere between 6 and 8 grams of fish oil a day. 6 to 8 pills. It sounds like a lot, but it's really probably less than what you'd get from eating a piece of raw salmon. Berberine to help with insulin sensitivity. CoQ10 helps with heart rhythms. Baby aspirin also helps with thinning the blood and keeping, you know, you know, preventing clotting. One thing that I would warn with baby aspirin is if you have any issues with stomach ulcers, you might want to stay away from it, and you need to make sure you take it with food. It can exacerbate stomach ulcers, or bleeding in stomach ulcers, so be careful with it. Carditone, this was recommended to me by Dante Trudell a long time ago. It does seem to lower my blood pressure. Not as significantly as the blood pressure medicines, but it does have an impact on my blood pressure. And a fiber supplement. I take psyllium husk every day before bed. Um, other people pointed out that they didn't see a lot of fiber in my diet, which is true because I have IBS and it just blows my stomach up. But I tolerate the psyllium husk well. But the psyllium husk has been shown to lower cholesterol. So a good fiber supplement will help with that. All of these things will help counteract some of the damage that you're doing with the PEDs. I'm not saying they make you bulletproof. The best thing to do is not to use PEDs at all. Be lean, eat a healthy diet. I forgot to talk about cardio. A lot of guys skimp on the cardio. I've been guilty of it. I fucking hate doing cardio. It bores the fuck out of me. But making sure that even powerlifters, everybody, you should be doing some sort of cardio year round, 3 to 4 times a week, something to get your heart rate up, sustained and up, to help with your cardiovascular health. It does make a difference. Anyway, that's all I have on this. If you have questions, please feel free to ask them. I will answer questions as best I can. I don't know everything, but I can certainly point you in the direction or do some research and find out. If you have suggestions for other videos, let me know. I'm happy to do those as well. As I mentioned earlier, please like and subscribe. I'd really appreciate it. The YouTube gods like it when you subscribe to my channel. I get a lot of people watching, not a lot of people subscribing. And if you want to keep up to date with me, follow me on Instagram at Paul K. Barnett. Thanks. Have a great day.